Hello, thank you for tuning in. My name is Kelly Wilber. I'm a pediatric speech language pathologist. I'm here to speak with you today about late language when repeat after me doesn't work. I have three primary objectives for our conversation today. The first is to discuss what is typical or what is normal. There's a wide range of what is considered normal speech and language development, and there are some misconceptions out there. I hope to clear up some of those misunderstandings. The second, when should I worry, or what are the red flags that should prompt me to maybe seek intervention or get a referral for speech and language therapy? And finally, I hope to replace some of that worry with practical hands-on strategies that you can start to incorporate right away for your early language learner. For the next few slides, I want to discuss what is typical overall. And then I'd like to dig into these specific ages that we're talking about here. And for the sake of our conversation, we're thinking of approximately birth through age 6. Sometimes an early communicator might persist beyond the age of 6, and sometimes kids are very verbal well before the age of 6, but just for the sake of conversation, we're speaking generally about a developmental level of birth through about age 6. So when we're looking at typical verbal language development, we're looking at first words to emerge at about 1 year. These kids should be building their vocabulary. We want to see about 50 words around 18 to 21 months so that children can reach the big milestone of putting words together at about 2 years of age. We're looking for maybe 2 to 3 word phrases at 2.5, and a child should have very intelligible or understandable connected speech at age 4. A good rule of thumb is a 2-year-old should be approximately 50% understandable or intelligible to an unfamiliar listener. A 3-year-old should be about 75% understandable to an unfamiliar listener. And a 4-year-old should be very intelligible, greater than 90% understandable to an unfamiliar listener, though it is still normal to have some remaining speech sound errors beyond the 5 and even the 6-year-old age level. Okay, so let's look at the specific ages and stages. You probably came here today thinking of one or more particular kids, so hopefully you can really tune in to the age and stage where they are. By age 1, your child should be able to recognize his name. We're looking at maybe 2 or 3 words like mama, no. They should be able to imitate some familiar sounds, environmental sounds like car sounds or animal sounds. Follow simple directions. Where's your nose? Recognize words as symbols for objects. And the last one is my favorite for this age group, being able to direct attention and to establish joint attention. When I think of joint attention, I think of a communication triangle between you, the child you're communicating with, and whatever object you're working with together, a toy or a book. So that child should be able to readily look back and forth between you and the toy, and between you and the toy, and you have this beautiful communication triangle happening. This is not an all-inclusive list. These are just some of the bigger heavy hitters that I like to think of when I am looking at a 1-year-old. Moving forward, between ages 1 and 2, we're looking at these ideas or these expectations. We would like that child combining having 10 to 50 words so that they are combining by age 2. We are looking at that child to be able to make lots of animal noises, to be able to follow a direction such as bringing an object from another room, pointing to a variety of body parts, using function words such as more, giving you a toy when you ask for it. Moving up to between ages 2 and 3, look at that vocabulary jump. We're looking at maybe a 450 word vocabulary. Closer to age 3, of course, can tell you his name, labeling body parts, asking simple questions like what's that or where is it, using negative phrases such as no, I don't want, understanding simple time concepts like last night and tomorrow. We're looking for word endings at this stage, whether it's plurals like books, eyes, or just putting ending sounds on words in general. Another page for this age group, these kids will be able to talk to other children as well as adults. They can answer some basic where questions if the answer is maybe right in front of them. So, where do you sleep? Pointing to a bed, for example. Where's mom? Oh, kitchen. Matching some pictures and colors using short, simple sentences like me want cookie or me want more. Between ages 3 and 4, these kids should be able to tell a short story in sequence. They might have a sentence length of 4 to 5 words. Look at the vocabulary expectation, how it just jumps up. The comprehension is still emerging here, understanding different describing words like hot and cold and little and big. They can follow requests with spatial concepts like understanding the difference between under, on top, behind. Can tell you a variety of nursery rhymes. Between ages 4 and 5, a sentence length of possibly greater than 4 to 5 words can start to use different verb tenses, a vocabulary of 1,500 words maybe, pointing to and labeling different descriptors and asking many, many questions, including who and why. I have one more age group here for you. Between ages 5 and 6, the sentence length continues to be greater, can understand and use different opposites. Look at the vocabulary, maybe 2,000 words, can ask you a question for information or for clarification using different types of sentences, not just simple sentences, but also compound and complex sentences, and can tell you not only what an object is, but what you would do with that object. Okay, so that was a lot. And again, that list was not all inclusive, but these are just some talking points when you're maybe considering a speech and language evaluation. You can talk with your provider about a referral if needed. Moving on to the second part of our presentation, when should I worry? What are the red flags? We know that the following 2 slides here, we know that these items are predictors of continued language delay in toddlers. So if your child is exhibiting one or more of these features, you might want to consider discussing this with a speech and language pathologist. So here they are. If the child has a small vocabulary for his age, we saw those age level vocabulary expectations. So having a very small vocabulary, that will limit him moving forward. Then he won't be able to, combine words, won't be able to use different types of vocabulary. So we are looking at what type of vocabulary he has. Less diverse vocabulary, particularly verbs. Some children will be able to, tell you all about farm animals or dinosaurs, but really they don't have a lot of describing words or action words. So we want to see what is included in their vocabulary. There's a comprehension delay. So comprehension often gets overlooked in kids when a speech delay is a concern. When we look at comprehension, it's a huge piece of language development, and the comprehension piece, if it's right here, the expressive piece should be pretty close to it, and they should be developing neck and neck. If there is a delay in comprehension and what the child is understanding, we want to intervene. We want to see what's going on. And likewise, if there is a gap between what the child is understanding and what the child is using, whatever that gap looks like, if the comprehension is higher or if the expressive language is a lot higher, we don't want the gap to be very large. The next one is few pre-linguistic vocalizations. This is babbling. Your early communicator should be babbling early and babbling often. And not just babbling, but babbling, how are they babbling? So is your child using consonants and vowels? Your speech therapist will be listening for, are they using consonants and vowels? Are they using different patterns? When they're babbling, what types of syllable structures are they using? Are there vowel errors? Sometimes motorically, we think that vowels are easier to produce than some consonants and combinations. So when there is difficulty with vowels or there are errors with vowels, we want to see why. If there are few spontaneous imitations, young communicators should be great at imitating. Even if they don't get it right all the time, they should be trying to imitate you quite a bit. And how are they playing with toys? Are they playing with them functionally and symbolically? Cars, for example, are they zooming them down a ramp and crashing them, or are they just lining them up and spinning the wheels? We want to see how children are playing with toys. Gestures. Kids should be using gestures even if they're not talking. So whether they're waving or pointing or shaking their head, yes and no, we want to see a lot of gestures in early communicators. Are there behavior problems associated with the frustration of not being able to communicate effectively? The next one is few conversational initiations. Just as we want children to be good at imitating, we also want them to be initiating, to be coming to us to seek reciprocal communication and to start an interaction. Are they interacting just with adults, or do they interact with peers too? Recurrent middle ear infections. We know that if there are recurrent ear infections, that it is possible that the acoustic signal, the auditory signal going in, could be dampened, and therefore children don't have a full access to be able to hear and understand and interpret and process all the language coming in. So we want to make sure we have that managed. And a family history of persistent problems in language learning is another area that we want to address. Okay, there are certain developmental delays and disabilities that could impact your child's speech or language development, and you can see that list here. This is not an all-inclusive list, but sometimes when there is a medical diagnosis involved, then yes, speech and language development could be impacted as well. Okay, I would be remiss if I didn't take a few minutes to talk about the importance of comprehension of language as the foundation for language learning. You can't have talking without comprehension of language. And sometimes as parents, we tend to overestimate our kids' comprehension. And when I ask, parents might say, oh yeah, he understands everything I say. But when I start to probe a little bit more, I might ask, is he pointing to his body parts? Is he following a direction? If you ask him to get something in another room, can he point to a picture in a book that you ask him to? Then that's when we start to see some of the communication challenges in the area of receptive language or comprehension. So armed with this knowledge, even if your child is struggling with verbal language, know that you can work on and practice and promote the comprehension pieces of language, and that will absolutely help support his overall language development. We'll talk about that as we get to the next phase of our presentation. Okay, so I have a few slides here to talk about language prerequisites. Sometimes we call them pre-linguistic skills. These are skills that we need children to master before we can expect words or verbal language to emerge. Just as we wouldn't teach an elementary child multiplication and division before we teach him addition and subtraction, there are some language skills to learn first before we work on verbal language production. So the last part of the presentation focuses a lot on the how we do that, or the examples. So right now I want to talk about specifically what the skills are, and then we can dig more into the how we get there in the next part of the presentation. So here some of the skills are. Your child needs to be reacting to the environment, responding to people when they play with her, and taking turns with you during an interaction. We need to position ourselves in front of kids so that language learning can be multimodal and they have access to our facial expressions, the visual tactile cues that we're using. It's great for kids to run around and be active, but when language learning is a focus, stay and play is so important. So carve out time and experiences for your child to sit with you to stay and play, whether that is at a tabletop or in a high chair or on the floor. Make the interaction really fun. Okay. Your child needs to be using early gestures like waving and pointing. So sometimes I'll say to parents, we can't physically pull words out of your child's mouth, but we can promote gestural language. Like we can help him to wave, we can help him to sign more, we can help him to answer yes and no, high five. The pointing is huge. We can teach him to point if he wants something. The gestures are very important to work on. Kids need to be able to initiate interaction with others. So just as we talked about imitating is important, so is initiating. Well, how do we do that if, you know, my kiddo just kind of mimics what I say or do, but doesn't really start the interaction? Well, there's a couple ways we can do this. We'll talk about it more in depth as we get there, but you can use pause time, uncomfortable silence as a motivator. You can use sabotage. So if your child knows what a horse is and you intentionally label that horse, oh, it's a dog, and you wait expectantly, your child will most likely oftentimes initiate some kind of a communication exchange with you to let you know that you're wrong, and give a child credit for almost initiating. Oh, I like how you looked at me. Great job looking with your eyes, teaching him to expand. A few more here. We want kids to be able to understand early words, follow simple directions, vocalize or make sounds purposefully. Sound effects, noises, environmental noises are so important. So it's okay if, you know, we're talking about moo and woof woof. before your child is able to say like cow or dog, imitating actions, gestures, sounds, and words before we can expect them to imitate your words. Is he imitating your play? Is he jumping when you jump and clapping when you clap? Model lots of these interactions for your child. Wait expectantly for that imitation, and use simple language to narrate your daily events. Okay, we're getting in the car now, putting on our seatbelt, here we go. Your child needs to develop a longer attention span. So wherever he is, if he's able to complete one puzzle piece, that's a starting point. We want him to do more. So we can limit screen time, we can provide movement activities as a warm-up, but then we can require stay and play face-to-face time. And oftentimes, if a child lets me know he's done with something that he picked a puzzle, he's done, now he wants the blocks, I'll say, okay, I know you want the blocks and I'm holding them right here. First we do puzzle. So when we do the puzzle, then we do the blocks, and I will teach him that maybe that just means one more, just two more, whatever the attention span will allow for. But it's okay to use that mild frustration and that temptation to stretch and support her attention span. Shifting and sharing joint attention with others. That's that communication triangle that we mentioned, going back and forth with looking at you and whatever object you're focusing on. So placing yourself within that child's line of vision, playing with a variety of toys appropriately. Okay, before we get into the last part of our presentation, which is all the strategies we can use, I really like this fun fact slide to reinforce and to let you know that your child is hardwired and designed for communication. And we know these facts from NICU studies in which we can measure babies' biometric skills like respiration rate and heart rate and stress levels. We know that infants prefer mothers' voices to other voices. We know that babies prefer human voices to synthesize speech. And we know that visually, babies prefer to see something that has angles, curves, and contrast in light and darkness. And this is why baby mobiles are so popular. But aside from baby mobiles, can you think of something that we have even more readily available to us with these angles, curves, and contrast in light and darkness? And the answer is our faces. So all the face-to-face time you can spend with your little one, the more the better. And I use this opportunity as a little plug for distracted interaction time. So if you're feeding your baby and you're distracted and kind of on your phone, for example, we know that these babies are experiencing elevations in cortisol levels and stress, and they're experiencing a reduction in attention and the ability to learn from your facial expressions and your voice. So just, armed and equipped with that knowledge, just know how important it is to really spend that face-to-face time with your baby, whether communicating with him with your facial expressions or with your voice. It is all a language learning opportunity. Okay, so into the heart of the presentation, when repeat after me doesn't work, I came up with 6 strategies here that we'll talk about, and then I realized there are so many more, so I highlighted a dozen or so more after that. So please don't feel like you have to use all of these strategies or remember any of them in particular, but I'm hoping that you find 1 or 2 or 3 that really resonate with you and the child that you have in mind right now. So the first one is providing access to AAC. This is augmentative and alternative communication. It is an approach to communication that uses any and all means available. Maybe it's manual signs, communication boards, maybe it's a little bit of verbal language, gestures, speech output devices. So it's multimodal and it allows a child to use every mode possible to communicate messages and ideas. Okay, why would I do this? If I want my child to be verbal, why would I use some other way to communicate? Well, in the absence of a conventional way to communicate, a child may express his needs in socially unacceptable ways like aggression or destructive or perseveratory means. So AAC systems, whatever that is for you and your child, can replace these unacceptable means with more conventional, positive forms of communication. There are definitely myths associated with using augmentative and alternative forms of communication, and I want to dispel those myths for you now. AAC is not a last resort in speech and language intervention. Sometimes I'm incorporating that at the evaluation. We know that the bottom one says kids have to be a certain age. We know that babies are starting to understand and starting to use sign language, and any internet search can show you young children using basic signs and gestures. So the second one says AAC hinders or further stops speech development, and this is not true. We have plenty of recent research studies that show that using an augmentative form of communication supports verbal language development. Children must have a certain set of skills to be able to benefit from AAC. This is not true. What is true is that different AAC systems are better geared towards specific children than others. So your speech therapist can help you to find what is most effective for your child's needs. And the fourth one, speech generating devices are only for children with intact cognition, and that's not true. Children with cognitive delays are also able to benefit very much from devices. Okay, so this is the research study I was mentioning. When toddlers with speech delay were given access to AAC, their verbal, 94% of them saw an increase in their verbal language production. 0% showed any decrease in verbal language. So adding another form of communication supports your child's overall communication and verbal language development. Okay, and I just pictured that there for you. Taking a child with a reduction in verbal language and adding another way to communicate will yield an increase in verbal language productions. Okay, here's the next strategy for you, and I'm going to attempt to share this video with you. Minimizing pressure to speak. Okay, so parents, we mean well when we are trying to showcase and highlight our kids' skills and saying, say horse, I know you can say horse, nay. But sometimes minimizing the pressure to speak will allow that child to start verbally communicating. So the next video, you're going to see some of the ways, some of what you can do instead: modeling, giving choices, expanding, interpreting, using environmental noises, and then we will talk about declarative versus imperative language. So let me try to share this screen with you. Thank you for bearing with me.
Earth's best.
Okay, and let's see if it's working.
Make good food fun, and kids will love it for life.
Meet Jane, a clinic management software and EMR designed to help you open, run, and grow your
Looks like
practice.
we can
get
skip this ad, and here it is.
Mabel's experiencing some expressive language difficulties. Today we're going to talk about some strategies that can help promote her use of language. A great way of doing that is using some labels for her. So just modelling one word to her. That model can be a number of different types of words, whether it be a label or a hat, or whether it be an action, whether it be a descriptive word. Hat. And eyes, and another great way to promote language is also using choice making. So offering the choice to her: blue shoes, purple shoes. We put purple shoes or shoes, purple shoes on. We can also expand that language by building words for her, adding language to the words that she's already using. So great that you're talking about those shoes, using that one word, but we can try and put descriptive language in there as well. Oh, 2 shoes. 2 sets of shoes. Shoes don't fit. Shoes like this. Big eyes. And that's another great strategy as well, trying to interpret the words that she may be using. So if it's not coming out clearly, like you and I might say, taking a bit, 2 purple shoes. Great job interpreting those words that she's trying to say and expanding the language for her. Another.
Okay. Okay, so I hope you saw some examples there of what we can do besides providing pressure to speak. We can model, we can give verbal choices, we can expand. If the child is using one word, we're going to use 2 words right back at her. We can interpret if it comes out difficult to understand. Okay. Looks like there's a little delay here on the PowerPoint. Let's see if we can get to the next one. Okay. I'm going to stop the share and try again. Okay. And we're back. Let's get back to where we were. And we'll get back on track here. No problem. Okay, we mentioned declarative versus imperative language. For some children, they really benefit from us using more declarative versus imperative language. I'm not saying imperative language is always bad. There's sometimes that we do use it, but the declarative language really takes the pressure off and allows the child an opportunity to be verbal. So here are some examples. Declarative language would be, hi friend. Less, or imperative language would be, say hi to the friend, say hi. Oh, there he is in the box. Imperative would be, where's he hiding? Tell me, show me. Declarative would be red ball, just labeling and modeling. Imperative would be, can you find the red ball? Where is it? What color is it? Declarative is moo cow. Imperative would be, what does the cow say? Say moo, say moo. And you can see the other examples there. So using more declarative language and less imperative language does take the pressure off. Imitation. Imitation is so important. It promotes social learning, cognitive skills, language learning, social skill development, and problem-solving skills. It prepares your child to learn from others. Before your child's imitating verbal language, we're looking for him to imitate facial expressions, sound, actions, and play. Let's try this share again.
Imitation occurs in early development and is crucial building block to language development. Why are these skills so important? They will help your child develop social learning and new knowledge. A young child will observe a parent's facial expressions or sounds and attempt to imitate. Imitation is a form of trial and error, which allows children to learn through experience. It's important to children to have the opportunity to experiment with imitation of facial expressions, sounds, words, and actions. Children learn the sounds of language through imitation. For example, the infants will babble, ma, 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 and their parent will respond, mama. So children will experiment by imitating in play. For example, imitating shaking a rattle, banging a hammer, or pretending to cook or eat. A toddler observes a parent cooking and then develops early pretend play. Encouraging imitation skills helps your child to develop important cognitive, language, and social skills. This will prepare your child to learn from others. Imitation is a skill that may be difficult for children with autism spectrum disorder. Learning imitation is crucial as it allows a child to learn social skills through observation and imitation of new behavior.
Okay. All right, so moving right along, and there's that delay again, huh? All right. I have a little workaround we're going to try. And thank you so much for your patience. Love technology. Okay. Here's the next one. Okay. The next one is mother-ease or parent-ease. Sometimes this is called child-directed speech. Sometimes it's called infant-directed speech. Sometimes people say baby talk, but it's not baby talk, it's different. So motherese is exaggerated intonation and slow tempo. Okay, it's a way of speaking that has a slower rate of speech and exaggerated intonation and stress with more variation in pitch and loudness. So parent-ese or motherese is not baby talk. So baby talk is goo goo gaga. So motherese is correct grammar, correct vocabulary, but it's a more simplified grammar and a more simplified vocabulary. This is so powerful. We have so much research on the value of child-directed speech. We know that children, siblings as young as 3 years old, are naturally using this child-directed speech with their younger siblings, and there's so much science behind it. So sometimes I talk to dads about this, like, don't be afraid to use this simplified way of speaking with more exaggerated pitch and intonation. Your child really is learning. So let's try.
When we hear people using baby talk, most of us feel like we're not hearing what you might call a deep conversation. It's all high-pitched, sing-songy sounds and peekaboo and where'd the ball go and is that kitty cat? It doesn't exactly sound like a TED Talk. But even though it sounds kind of silly, there is a reason that it starts coming out of our mouths as soon as we see those adorable chubby cheeks. Ask the internet or a parent from an older generation, and you might be told that using baby talk with kids is bad for them. They claim kids who hear baby talk won't have the opportunity to learn proper adult speech. But research actually suggests the opposite is true. Baby talk, known to scientists as infant-directed speech, really does seem to help babies with their language development. Infant-directed speech is the unique way of talking that we use with babies. It has that really recognizable tone and rhythm. Our voices go up in pitch. We use a wider range of pitches to sing-song through phrases, and it has slower, more exaggerated vowel sounds. The general term for these tonal and rhythmic elements of speech is known as prosody. And research shows the prosody of infant-directed speech can help with the baby's attention and language learning. We've known for a long time that babies pay more attention to higher-pitched voices. And in a study published in 2018, scientists suggested that infant-directed speech could be more attention-grabbing because it's less predictable than the speech we use with adults. But once we've got a baby's attention, baby talk's slower rhythm and exaggerated vowels might play another role. For example, a 2010 study showed pictures of things like cups or rabbits to 19-month-old infants. The babies were told in a baby talky voice to look at a specific picture. And the more baby talky the instructions were, the more likely the babies were to look at the right picture. The idea is basically that speaking this way helps babies split up an endless, featureless stream of sounds into chunks that have meaning. You know, words. And other research has shown that isolated words are easier to learn. All told, there's quite a lot of evidence to suggest that prosody really does make a difference in helping babies pay more attention to parental speech and gain linguistic skills. But prosody isn't the whole baby talk story. There's also discussion around whether infant-directed speech is grammatically simpler than adult speech. And this seems to be where some of the controversy comes in. Here's the thing. Infant-directed speech does have a lot of short phrases and sentences. And historically, researchers thought that this meant it was a simpler kind of input that let babies learn by using easier forms of language. But as researchers argued as far back as the 1980s, that doesn't necessarily make a whole lot of sense. If baby talk is so simple, how do babies pick up on the more complex rules of grammar? That's probably what the people who tell you to speak properly to kids are getting at when they say baby talk is bad. But even if sentences of baby talk are shorter, they're very grammatically correct. While we might take shortcuts when it comes to speaking with other adults, the grammar we direct at kids is usually much more accurate. And infant-directed speech can actually model many different but overlapping grammatical structures, which provides complexity. This is why we say things like, "Where's the doggy?" and then follow it up with a bunch of other statements that basically rephrase the same idea, like, "Is that a doggy? Yes, that's a doggy. Let's pet the doggy." There are other debates about baby talk too, like whether cutesy words like choo-choo have any benefit. But when it comes to the prosody and grammar of baby talk, we probably don't have much to worry about.
The next one is augmenting auditory, visual, tactile, and proprioceptive feedback. We know kids with speech sound disorders, for example, may be less able to pick up on the sensory feedback typically available. That's why you'll see a speech therapist using a lot of tactile cues, so bringing attention to what the mouth parts should be doing. always having another opportunity for what to listen to, or providing a visual support if you're learning about, animals, having pictures of animals, having the little manipulatives of animals available to provide additional feedback. Don't just rely on one. The next one is focusing on function. So avoid emphasis on non-speech articulator movements. Like, I'm not going to say to a young child, use your M sound, right? I'm going to say, that's yummy. Can I have some more to eat? So really making it functional for the child. I was working, a child was leaving off H sounds at the beginning of words. So instead of saying hi, she would say I. So we would really work on making it functional using our windy sound, and then waving hi, or Santa Claus says ho ho. So really making it functional for the child and meaningful for the child to help it to stick. All right, so we got through some of those top 6 strategies, and then I found some more strategies that I can share with you and give you some examples. Hopefully you find something that works for you and your little one. Slow down. I tend to be a fast talker, but we know kids with speech and language delays, they need extra time to process all the finer parts of speech and language message that is coming through. We also know that they're more likely to miss important pieces of information. So what doesn't work is telling ourselves, slow down, or telling a child to slow down. But what does work is intentionally interjecting pauses into our speech where we normally otherwise wouldn't put pauses. So that can really help slow you down, which gives that child a little more time to process whatever it is you're saying. We can emphasize the key points. So because delays in expressive language are very often accompanied by delays in receptive language, sometimes we can use too much verbal language. So instead of saying, go get your blue coat and get in the car, we're gonna go to grandma's house now. You might say, oh, blue coat, ready? Car, go in the car, let's go see grandma, right? So emphasizing the important parts of the message will help them to tune into what's the most important thing to focus on right now. We already talked about adding a visual, a gesture, or some kind of a cue is very valuable to give kids more than just their auditory system to learn from and to lean on. And repeat instructions. Don't be afraid to sound like a broken record. Simplification, motivation, repetition, all used together are so powerful. Let me show you this video.
As a speech therapist, there's 3 main things that I keep in mind whenever I'm trying to teach a child something new, anything, but especially speech, but anything new, I keep these 3 things in mind. 1, simplification. 2, motivation. And 3, repetition. Let me give you an example. For bubbles, let's say, very easy, popular activity. Most people have this at home. First, I'm thinking simplification, okay? How am I going to simplify these words for the child? Some words that come to mind are bubbles, pop, blow, again, more, please. Those are really easy ones, right? Okay, so bubbles, if my child that I'm working with is not talking at all, maybe bubbles is too big. Please, ooh, that's a good one. The PL can be hard. The easiest one I can think of is more. And I always use signs with the new talkers or late talkers. So I'm gonna have them say more. I'll blow the bubbles first and I'll go, ooh, ooh, pop, 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 pop. So I've picked more, ooh, and pop. I've chosen 3 words. I've simplified the task to 3 super easy 1-syllable sounds with no consonant blends like PL and please, a little bit hard, right? And I am too going to use motivation. I'm going to get excited about the bubbles. I'm going to have it nearby, but not allow the child to grab it and just do it all by themselves. So one of the biggest mistakes I see people do when they do an activity with a child, they let the child get the item before they can even practice a word. So you have the bubbles, okay? Parent or teacher, you have the bubbles. And so you have it near, ooh, more, dilly. So it's all in the excitement and the motivation. You have the item, they want it, right? Maybe you don't have bubbles all the time. It's a special activity, okay? And then repetition, okay? That one's pretty self-explanatory, but how many times Kayla, should we say, that we repeat a word as many times as you can, really? I'm hoping a toddler, typically developing toddlers have attention spans of about 3 to 6 minutes on their own. With an adult guided activity, getting them excited, it should be longer. With special needs children who are behind, that attention span is often even more limited. So ideally, as many times as you can, I'm trying for at least 5 times to practice that more. And I'm going to repeat the whole sequence exactly the same way. More. Ooh, pop, pop.
The time needed to respond is longer. Kids need extra time to formulate their response. And I want us to be more comfortable with uncomfortable silence. If I'm working with a toddler and we're zooming cars down the racetrack and I'm saying, ready, set, go, and we're zooming and it's so fun and I'm saying that over and over again, by the 10th time, I might say, ready, set, and get really comfortable with that pause time. Well, I know that toddler is going to be expecting me to say go and zoom the car, and that toddler is going to hopefully be looking at me and going to be letting me know somehow that he wants that car to go. So you'll see an increase in that visual attention. Maybe you'll see a gesture, maybe you'll hear a word or a sound, but add extra time to respond. Don't be afraid of uncomfortable silence. Okay, here are some other things that your speech therapist might be doing that might just look like play, but that you can do as well. Expansion, recasting, parallel talk. Expansion, if your child is in the one-word stage, he says dog, hat, car, that's great. You want to expand on that. So sometimes we call this the rule of just one more. So if the child says dog, you say, oh, brown dog. If the child says car, I might say, go car. If he says hat, I might say, big hat. So if he's using 2-word phrases, maybe I'll use 3 to just add to what he's saying. Recasting, we don't always have to have a child fix if they say something wrong. Me want it, me turn, he says. And so I might just say back, oh, my turn, I want. Just recasting back to them in a more correct way, sometimes a more expanded way. You can use both of those strategies at the same time. Parallel talk, very similar to parallel play, except it involves talking. So you are just talking beside your child as he's playing, like red block, wee, go down, yellow block, wee, go down, parallel talk. The child-directed speech, we already went into that. That's a fantastic one. Using the visual cues, providing feedback is amazing. Of course, every child needs to hear, good job, you're doing awesome, but providing specific feedback is very valuable so they know what we want them to emulate again the next time. So you use 2 sounds. You said bubbles, or you used 2 words. You said my turn. So telling them specifically what was awesome, and then increase the interaction opportunities. So any more face-to-face time or stay and play time is very valuable. Now, all of these techniques have big effects on increasing the total number of words, the length of his sentences, and the number of different words, and the amount of understandable utterances. Okay, there are more. So hopefully you found something that you think might be helpful to try. Communication temptations. These are awesome. You'll notice if you come to see us at the clinic, a lot of our toys are in clear plastic bins or boxes so the child can see and get excited about what they're going to play with. But just like the woman in the video was saying, they can't necessarily access them without practicing whatever skill we're practicing on. So in the home setting, that might look like putting all the toys away except for 1 or 2 or 3 and having them in sight and out of reach so that your child has to maybe communicate with you in order to play with them. Sabotage. I think there's a slide for that coming up, but kids like it when we're wrong. So if you call a cow a pig or a pig a cow, sometimes, and a child knows the difference, sometimes that will prompt a child to use verbal language to correct you. Reinforce new vocabulary, provide new experiences, let the child listen. You can do listening game with books on tape or different animals that they might hear. Choose functional targets that mean something for your child. So I always like to know, what is your child like? Is it Bluey? Great, we'll incorporate Bluey into whatever we're doing. Make a communication brag book. Sometimes we'll put their words, maybe they have 3 or 4 words, we'll put that in a communication book so they can get really confident in saying these words. And then it's exciting to see how quickly we can add to it. Avoid overcuing, enjoy success. We'll talk about some of these now. Communication temptations. So it helps your child to initiate a conversation instead of just responding. So we mentioned that you can put your toys in sight and just out of reach. You can put them in clear plastic bins or boxes that don't open without your help. So the child has to interact somehow, whether that means, asking for help with a sign or using his words or looking at you, whatever that means for your child. I'm going to skip this video because I don't have confidence in the technology right now. So here's just some examples. You can hand your child a toy that they require help with, and maybe like a wind-up toy or a closed jar of Play-Doh. Wait for your child to ask for help. It's snack time, give them the spoon and the bowl, but you forget to give them the yogurt that's right over there on the counter. Maybe you give them just a few goldfish at a time and they have to work on requesting more. And we talked about putting a toy that the child likes maybe just out of his reach so they can practice asking for it. Okay, this is when sabotage is when you create a problem so that your child has to fix it. This is neat. And let me see. Again, I'm going to use this graphic instead of video right now. So here's an example. We talked about giving your child at mealtime, give your child a bowl of cereal and no spoon. See if they will do something to start an interaction with you. Pretend to eat your child's food. Pretend to put a shirt on your head instead of on your body. During playtime, we talked about the sabotage of keeping toys in the container they can't open. Put your shoes on your hands. Do something silly to elicit a reaction. You can just see some of the strategies there. Yeah, some of those are really helpful. All right, let's see. Bring up the share again and okay. Avoid overcuing. Okay, so we talked about this a little bit with the declarative language versus the imperative language. In this video, you're going to see that child says what the mom asks her to say, and then the mom gets so excited that she asks her to say it again and again. And we just want to be cautious with that, avoid overcuing. We want to be sure that we're reinforcing their attempts to communicate.
Do you say it? You can just say
When in doubt, a speech and language pathologist can help. So don't hesitate to talk with your doctor about seeking a referral if it's needed. You can use some of the talking points in this